So it is absolutely a pleasure that I have to introduce Dr. Beth Stormshak. Dr. Stormshak is the Knight Chair and Professor in the Counseling Psychology and Human Services Department in the College of Education and the Director of the Prevention Science Institute at the University of Oregon, which we won't hold against her. And she even very graciously wore orange today to come into our space here at OSU. Dr. Stormshak's research focuses on understanding risk factors in early and middle childhood associated with the development of problem behavior in late adolescence, including substance use and delinquency. Her primary research focus includes testing the efficacy of family-centered interventions, such as the Family Checkup, that reduce the later risk of problem behavior. She also studies the process of dissemination of evidence-based interventions into real-world community settings and has developed an online version of the Family Checkup for wide-scale dissemination. So thank you again for being here, and please help me welcome Dr. Beth Stormshak.
Thank you. Okay, I'm going to try to get this situated. Can people hear me through this mic? Okay, it's working. Okay, let me put it on.
It mainly people on.
Okay,
But I think it does help.
no, okay, it's okay.
That is you just be closer.
Okay, I've got a big mouth. I think that'll work. Okay, I don't want to hold it though. Is that okay? Okay, I'm all ready to go here. Hi, everyone. Well, welcome. Thanks for coming. I think this is a pretty good crowd for Friday, rainy. We've all had a very rough week. So thanks to all of you for coming out to share this talk with me and talk about research that involves family engagement. So I'm Beth Stormshak, and Shauna, thanks for introducing me. I've been at the University of Oregon a long time now, 29 years actually. And I was saying, I think this is the first time I've done a talk at Oregon State. So I'm excited to be up here. I mean, yeah, it's going to be fun. I'm hoping that we can talk more as the day unfolds about some of our possible collaborations between the Prevention Science Institute and what you all are doing here. That's why I've got the beaver and the duck there. See, they can be friends, right? And as I was telling folks, I am an original from Corvallis. I did grow up in Corvallis and went to Crescent Valley High School. Apparently, Shauna did too, so that's exciting. And my parents are here today. They still live in Corvallis, so it's kind of fun to invite them. My dad was a professor here at Oregon State in animal science, so that's kind of fun for me as well. So thank you for welcoming me. Okay, moving along here. So who's heard of the Family Checkup or knows anything about the research? All right, good, Megan. Yeah, Shauna. Yeah, excellent. I thought what I'd do first is just give a little bit of a history of it and tell you a little bit about what it is. And then I'm going to talk about the digital model and why we started to develop a digital model, which we did before COVID. I'm grateful for that. And then I'm going to go over some of our clinical trials and research, primarily focused on the digital model. So that's kind of what we're going to do today. So Family Checkup is pretty well-known intervention now in the space for child prevention of problem behavior and substance use. It was developed at the University of Oregon starting about 30 years ago by my colleague Tom DeShawn, and then many others were involved in that development, as myself and many other people. It's been funded by the National Institute of Health, the CDC, Department of Ed, and most importantly, as you all know, as public health specialists, it's on a lot of the registries. It's recognized as an evidence-based model. So we're able to have much more reach with this model than we would otherwise. So over the many years we've been studying it, we've worked hard to get it recognized in that way so that we can have strong community uptake. And the model, kind of in a nutshell, involves three steps: an initial interview, then a child and family assessment that's norm referenced, a feedback session that involves motivational interviewing that's very strength-based, and then it moves into a menu of options for folks that often involve brief and targeted family management skill training, maybe family management weekly meetings, parenting groups, or other community resources. So that just kind of gives you a sense of the model, what we now call the in-person model. And that's the model that was studied early on and over, probably 20 years of research. Many outcomes associated with this work over the years, direct targets such as parenting skills and positive parenting. We published a lot in that area. We know the Family Checkup improves some secondary targets such as self-regulation, school involvement, reductions in family conflict and parent depression. And then we've followed a lot of these samples now over multiple different cycles of grant funding. In fact, the original project, Project Alliance, was followed until the intervention was in middle school, and we followed the kids into their like 30s, and really looked at adult outcomes and found improved behavior in high school and in that transition to young adulthood, and then long-term improvements in depression, suicide risks, healthy adult relationships, arrest rates, and high-risk behavior. So there's really been a lot of evidence now for the in-person version of the family checkup over time that I think is really exciting. So what does that mean for the model in terms of us disseminating it and bringing it into community settings? Well, I'm kind of using Ogden's stage model here to think about the different stages of taking something to community-wide scale-up. And the family checkup is really one of the models now in that phase, stage 5. We've done the refinement. We had a lot of efficacy trials, Project Alliance 2 and 1, which were with middle schoolers, early sets, which was early childhood. Then we did at stage 3 what I call efficacy kind of community trials, where we worked alongside folks in schools or community mental health. And we had our staff doing some of the intervention, but then we trained real world providers, and we kind of did these hybrid, I guess we call them hybrid effectiveness trial. That's kind of the term we're using there. And then we had a number of different clinical trials that are fully stage 4, where we're training real world providers and testing outcomes and testing reach in the model. And now we're really in a scale-up mode with the family checkup, and it's being used all across the country, which I'll show you here. I do have a spin-out company now at the University of Oregon that's the primarily supports the uptake of the model, both in the U.S. as well as globally. And this kind of shows where we're working with communities all over the country now in the in-person version of the family checkup. So we've been training a lot of folks and helping different community sites uptake the model. And that's kind of where the family checkup in person is in terms of its development as a model out there. So I just kind of wanted to share that history with you. So what about this digital model? Let's talk about that. Why did we develop a digital model? So when we were doing our effectiveness trials, and primarily in schools, we were trying to work with school personnel. And this was long before COVID, by the way. So this was like in, the early, like 2010, around there. We were working with school personnel to deliver the model. And of course, we received the same feedback all the time. And you probably can guess what that feedback is, which is that we don't have the resources to do this. We can't really deliver this kind of intensive model in the context of schools. We don't have enough providers. We don't have the right infrastructure for it. So a lot of those effectiveness trials really weren't all that successful in like having uptake and sustainment afterwards, at least and particularly in schools. So the school personnel that we worked with gave us lots of feedback and said, if you had a digital model, something parents could do asynchronously, something we could just provide for families, and then they kind of could come back for support as needed, but a tool that we could use to really reach some of the families we're trying to reach. We think that would be a much better delivery system for schools. And so starting around 2015, we got our first NIH grant funded to develop that model and start testing that model in schools and other settings with these goals to reach more children and families that we were able to reach with an in-person version, to embed it in systems of care that have limited providers like schools. Well, of course, since 2015, our schools had fewer and fewer providers, actually. It has not gone in the right direction for schools. So I'm really glad that we went down this path. We wanted to develop something that was accessible to a range of families. And of course, as you know, a lot of people don't seek services in community mental health or in even early childhood. They're kind of out there with no services. And so being able to provide this to families that really were harder to reach from our in-person services was important to us. Meet the growing demand for digital health and telehealth service delivery. And then, as I said, responding to feedback from community providers. That was really kind of one of our drivers of creating this model for people. Okay, so I'm going to talk about some of our recent projects testing the digital model, and then I'm going to kind of show you what it looks like, and then we'll kind of talk about some of the results. So we've had a couple of recently funded grants to test the digital model. The first one we call Parenting Young Children, and that grant was funded by NIDA. It was part of a P50 Center grant to the University of Oregon Information Science Institute. We worked with 356 parents of young children with histories of substance misuse or depression, and this is a randomized trial with a waitlist control group. The children were ages 2 to 5. And we kind of finished the final wave of data collection earlier this year. So we're just kind of doing analyses, and we have one paper published on that. We have a school-based middle school project that's funded by IES, and it started in fall of 2022. We've enrolled 282 parents with children in that, and those are middle school kids. And those kids have kind of either IEPs in place, or they have a history of low attendance or poor grades or mental health concern. So they kind of are a higher risk group than in the middle schools. And we're going to be training school providers at the end of that project, and we've completed enrollment. And then we have this other project, also a middle school project, and this was funded with COVID relief dollars, kind of right during the middle of the COVID pandemic. And it was funded by NIH. We enrolled 181 parents of middle school families from Oregon, and it was a randomized controlled trial. And we've completed that and published quite a bit in that with that project. So I'm going to talk a little bit about that today. That one was really interesting because our goal was to kind of start that at the tail end of COVID and really reach parents with a digital platform when they, as you know, in Oregon, we all lived here, they were not in school, right? Kids were not in school. And then because of delays and everything that happens when you run clinical trials, we were a little delayed in starting. So we actually kind of started the trial in the fall when kids were scheduled to go back, which was 2021. But then, as you know, what happened in Oregon is that we kind of didn't have a strong rollout of school in that fall. And actually, in January, when we were kind of in the height of this clinical trial, we shut down all our schools statewide again, if you remember, especially in the urban areas. And there was like a month when kids were home again, and then they came back. So it was kind of interesting. Although we were more delayed in starting it, we still really tested this during the pandemic, during a time when parents were really stressed out about the pandemic. So that was just interesting. Our state school situation kind of worked in our favor in that situation. Not for the kids and families, though, unfortunately. Okay. So we're going to talk about all that today. So here's that kind of gives you a sense of what the digital product looks like. So we have two versions of it, a school age version, which has 5 modules, and they're focused on wellness, self-care, positive parenting, parenting, substance use, proactive parenting, rules and consequences. And then an early childhood version that targets parents with young children, ages 18 months to 5. And it has more of a focus on parent mental health and harm reduction than the school age version. And all the versions are available in Spanish and English. So we're able to really outreach to a large community. So following from the original Family Checkup model, it's very similar in its approach in that it involves an initial meeting and setup that may involve just us setting up the platform for a parent and maybe just a discussion of goals, brief. And then the parent does an online assessment and gets feedback from the app. That's all now embedded and programmed into the app. And then there's specific skills training that's delivered as part of the app asynchronously. So people just go through it on their own schedule and their own time, and they get the content. And there's no provider needed for any of that. Providers can provide check-ins after the assessment, check-ins during the feedback time period, or any time when people are going through the modules. And we've tested it mostly that way with coaching in our efficacy trials, but it can be delivered as a universal. So this just giving people a sense of the content of the program is at its core, a behavioral parenting skills training program that's really grounded in positive parenting. It's just probably some of the words you think of when I say the term positive parenting. And this is it's very heavy on content that's strength-based and focuses on parents having positive relationships with their children and developing positive parenting skills with their children. So there are lots of activities around that in the app that help parents praise, create incentives, create a positive family environment. And that's kind of, if I had to name one content area of the Family Checkup, that's what I would identify as the primary content area that parents experience when they do the app. So parents, log into the program. This is the screen they see. They see the different modules to go through, and they can click through the different menu items as they complete the modules. And it's pretty straightforward the way that it's developed as a web-based application. At the beginning of each module, parents complete a very brief survey. You can see this survey is on positive parenting, and it's only 10 items. And they go through each item and they rate, how this item affects their family. And then they receive their results. And this is what the feedback looks like. And it's organized around areas of concern, anything that needs attention, focus areas, and then areas of strength. So following from the model, which is strength-based, trying to guide people to focus on their strengths and build from their strengths in the interactions they have with their children. The content goes into this Healthy Behaviors for Stressful Times module was funded during the COVID pandemic. And we were careful not to call out COVID, but to just talk about dealing with stressful times with your child. And this is mostly targeting middle school youth. And so we focus on listening skills, talking to your child, creating positive relationships, and healthy routines in the content of that module. What we've tried to develop is something that has not too much need for reading. We know that people, and I'm sure you would include yourselves in this, you're not interested in going onto an app and reading a bunch of content like you're in a class, right? The app is very activity-based. So there's all kinds of things that you do with your child. You think about your goals as a parent, and you try those things out. The app is you're guided through it by this bear family that you see here, and they kind of help you think about your skills and think about ways to change your skills. There's lots of little quick animations of the bears, which we had developed from our first grant. And we had some animators who had used to work at Disney in Los Angeles actually helped us develop all these animations. So now that I've said that, I'm going to show you, and you're going to be like, well, that doesn't look like Disney. But they're better than what we could have done. Let me tell you that, okay? They're not the level we could have done. So there's something between what we would do at the University of Oregon and Disney. And then we hired actors to voice over them. So that was kind of fun. It's fun to do things that are a little different from what you normally do, like interviewing actors. So I enjoyed that. And then it's gamified. So parents go through it and they get points for completing the modules, and they get like celebrations at the end. And it has a gamification too. When we developed it, we did a lot of focus groups across the state in both rural areas and urban areas of the state. We showed mock-ups to parents in the right age group. We got a lot of feedback about what they would want to see in an app like this, the color scheme, the graphics, how they would use it, if the gamification would be meaningful. So we really did the development in that kind of forward way, mostly with citizens from Oregon. So that's was kind of fun. That is what it came up. So now I'm going to talk just a little bit about some of our results from some of our clinical trials. This is the middle school success study that I talked about that was run during COVID with 181 parents and children ages 10 to 14. We recruited through schools and social media with a demographic that's reflective of our population in Oregon. We followed people up to 6 months and randomly assigned them to receive the intervention with a coach or waitlist control. And we published down this data, and we found over the 4-month period that we had reductions in parent stress that were reported by parents, improvements in family conflict, so reductions in family conflict over time, improvements in proactive parenting, which is a key target of the Family Checkup, and improvements in limit setting and managed child behavior. And what was really important for us is, do those things translate to mental health and reductions in mental health for kids? And indeed, we've now published on that. Our data suggests that these improvements in proactive parenting at 2 months led to reductions in child depression at the 4-month time point with the digital app. So we're excited about that because that really connects our targeted mediator with our targeted outcome, mental health. We collected a lot of data on our coach version versus the universal delivery, which was our waitlist control. We found that for the coach version, 97% of people engaged with the coach, which is a pretty good amount, versus 60% for the universal. They engaged in with the app. Sorry. So when people had a coach, let me clarify. 97% of those people went through the app and did it. If they didn't have a coach, only 60% of them went through it. So that's what we'd expect, right? Families in the coach condition spent more time on the app, but the number of minutes on the app wasn't that different across the conditions for those who engaged and those who didn't. Parents engaged in about 5 coaching sessions and 10 visits to the app. And parents across both conditions reported reductions in stress, although these were greater in the coach condition. So we kind of found what you'd expect, that the coaching and supportive person that worked with families improved outcomes with the digital app. There are some benefits to the universal delivery, but more with the coach delivery. That's basically what our data show. So I'm going to move on to talk just a little bit about our early childhood outcomes. And this is the early childhood app again that have more of a focus on parent wellness and self-care. A lot of this version was funded by NIDA. So we have a module in there, parenting and substance use, that really focuses on harm reduction and how to manage parenting in the context of substance use. Positive parenting, proactive parenting, rules and consequences, kind of standard parenting skills that you would expect during early childhood that follow from our curriculum. In this study, as I said, 356 parents were enrolled. We oversampled in rural Oregon, so 47% of these folks were from our rural and outlying areas, which is really of interest to me. We had community collaborations in Douglas and Josephine and Jackson County that really kind of jump-started us with this project. Helped me start. You're wondering who it was. 30% of the sample reported of clinically significant symptoms of depression or anxiety, and 24% reported using marijuana once in the past. 32% with a history of opioid use, which is pretty high. It's a pretty high risk kind of early childhood sample. 45% food insecurity, 27% with a high school degree or less. So that's what this sample looked like. We have published now on some of the outcomes from this, and we found at 3-month follow-up improvements in parenting confidence, use of parenting skills in the area of limit setting and rules, proactive parenting, and positive behavior support. Improved parent depression, which is a key target for us in early childhood, and we do have a whole module on that, so we were excited about that. And we find our results are the same or stronger at 6 months, and we're just working on that data analysis right now. And this just is a graphic to see subpar results, improvements in positive parenting at 3 months, improvements in limit setting, and then reductions in parent anxiety and depression. One of the things that I'm very interested in is the effects of an app like this and improvements in family relationships on substance use. And I can tell you in all my research over the years, that is very hard to find. And I think one of the primary reasons is it's not that we don't improve substance use or coping around substance use. It's that when we first meet people and enroll them, they don't trust us enough to tell us about their substance use for good reason. And then as they trust us more and more, they tell us more and more about their substance use. So in almost every sample that I have, it looks like we make substance use worse, which is, doesn't make for a compelling presentation to NIDA, who funds them, right? So in this app, one of the things that we're kind of digging into now is that there's the mini assessments, which I showed you. And then at the very end of when people have completed the program and they get their congratulations, about 4 weeks later, they receive another assessment. And that's all the same as the pre-assessment. So it's a post assessment in the app. And then if they complete that, they get another round of feedback. And they get feedback that kind of says, you improved your positive parenting over the time you use this app. You improved this. You did, And by the way, we find most people improve after that final assessment if they fill it out. So we've been looking at that data. So that's within subject data that doesn't involve a control group, obviously, because the control group doesn't get the app, right? And we've been kind of looking at the differences here in their reports of cravings, using substances while parenting. These are kind of some of the things we ask. Coping around substance use with your family, that kind of thing. And we find that at post-survey, our higher risk group, so these are the people that I think we identified who had a history of opioid use, are showing some improvements in their reports of that over time, whereas the lower risk group is not significant. So we're this is like really preliminary, but I think that's how we're going to try to dig into this data to see if we are making changes in that substance use variable. And I think it's a better way to look at it than comparing with the control group because of the reasons I discussed. So we'll see how that goes. Just some things that parents across the state have shared with us as we've worked with them about, sometimes people ask, well, do parents like this thing or not? Which is a valid question. Is this a boring thing you're making people do? So I think that for the most part, parents who engage in the app and go through it have enjoyed the experience. And here's some of the quotes that we collect from people, just going through the modules, maybe want to make some changes to my routines. The information was so helpful. I was able to use it right away. I learned to ask my child for one thing at a time and to praise her after she did it. And it works. It's made such a difference to me. I've noticed, and I'm more conscious of my parenting day to day, and it's brought positive and proactive parenting strategies to the forefront of my mind. And I've been able to put these skills into action. I wasn't expecting that, but it's actually made a difference. And I love that we could do the check-ins and really felt heard and supported by my coach. My coach listened to me and cared about my life. These are sort of some of the things people are saying. And hard to collect that in quantitative data, but I think it's important to listen to what people say about it and try to adapt it accordingly to fit the populations that we're trying to serve. So a little bit about future directions of where we're going with this. So obviously, online apps are feasible, effective prevention tool, and I think we're seeing a huge growth in this area right now in our field. I think a lot of people scrambled during COVID to put their things, whatever they were doing online, and so that's only going to grow more and more. And it, just brings up issues of how we can reach more people and reach more underserved populations. I know we're all interested in serving. I think that coaching improves outcomes. And one of the things we're trying to test is, but what is the benefit to universal delivery? And it's fun to come talk to you all, just thinking about that from a public health perspective of a universal delivery of this could reach so many people. And what could the reach be, an impact of something like that without a coach? Because it would be very cost effective to deliver with no provider involved. So thinking about wow. Our next steps include wide-scale dissemination. We have been working on this model to disseminate it and implement it in different settings across the country. We want to think about potential links to other health settings like pediatric care. Primarily, we've been working in what we call community mental health and schools, but not so much pediatric care, where we know, especially early childhood would be a big target there. Early childhood centers, we've been trying to focus our work and with some consultation from Shauna on how to reach more early childhood centers across Oregon and also nationally. And then refining the usability of the model with different providers. My colleague Jen Doty right now has a new grant focused on doing some adaptation for the model for Hispanic families. We have translated it to Spanish, but when people ask, well, is it culturally adapted? No, it's really just that's that surface level translation. And so Jen's grant is really, she's working across the state with providers as well as parents to look at the content of the modules and provide feedback for that population of Spanish-speaking families. And then we're going to take that and do some adaptations to create a new version that is what we can call culturally adapted. And Jen has a lot of expertise in community participatory research and just action around that. So I'm excited to partner with her on that and on that grant. And I think that'll really improve that Spanish-speaking version of the model. And that kind of gives you a sense. So I wanted to just, this is my last slide, but I have another slide after this, so I'll come back to this. So I put the last slide before the very last slide. So I wanted to show you just for fun. People sometimes like to see like the bear videos. What do the bear videos look like? And what do these really involve when people click on them? So we'll watch a bear video now. We'll come back to this, and then we can have a discussion about it. And it's a really great video. Let's see if I can get it to work. It was working before, right?
Watch this parent use an ineffective approach to attempt to get her child to do a household chore.
Sophia, do you want to eat lunch?
Put your toys away, wash your hands, and then get your lunch and take it to the table, okay? Mom wasn't in the same room, so she did not have her daughter's attention. She used an unpleasant tone and gave too many requests at one time. And finally, she asked a question instead of giving a clear direction. Now let's watch the same scene using a better way to give directions. Sophia, come into the kitchen, please. So I'm coming right away, Sophia. Wash your hands, please. It's time to have lunch. Salve on your hands. Now take your lunch to the table to eat. Notice what went right this time around. Mom had her daughter's attention. She focused on the direction and stayed calm and pleasant. And she used praise to support her daughter's behavior. And as a result, got the outcome she was hoping for.
So that gives you kind of, that's kind of like actually one of our longer ones, but they're always about that length. And most of them have kind of a wrong way, right way. Some of them are just a right way. Obviously, never just a wrong way. I'm confused. But it's like a wrong way, right way, or just a right way video. We kind of mix them up. And then after the video, sometimes in the program, there's like how would you do it differently? Or what would you, how would you apply this to your child? So that's kind of how they're structured. And each one of the programs has like 15 of these. So they're pretty constant as a parent goes through the app. They kind of see videos a lot along the way. They expect that this is going to be like the way that they're learning and thinking through the content. So there's a lot of these to show. And that is basically it. All I've got for you with the videos. So I'd love to take some questions from you. Sorry, I'll go with you first. The first person closer.
Two questions.
Okay.
First one was, so if in the app you identify some outcome is not being improved, you just find the videos. Is there any follow-up on that, or do you connect the parents to any resources where they can, maybe they need more than this to like work through that? Do you do that? And my second one was, if kids change schools, they still have access to this and continue the same one because it feels to be more school-based?
Yeah. Those are great questions. So let's see. The first one, if somebody's working with a coach and, if you're just thinking about implementation of this, people can use it in a lot of different ways. So an ideal usage would be that someone's working with a provider and they would be working with a parent. And if there's like an issue that's unresolvable or requires further intervention, then they could be referred out to other, more intensive supports in the community. So we would absolutely do that. And we've done that many times. But that would probably be the ideal use for a provider, to use this as a light touch. But then if you see something that needs more intensive service, you can refer out. And schools, when we do work with schools, once people log into this, they have access to it for a year, no matter what happens. So if they move schools or whatever. And then when we collaborate with schools directly, like the grant, I didn't discuss the grant where the kids are kind of higher risk and have IEPs because we haven't done the analyses yet. But those schools that have partnered with us will be working with it this year. And then they're going to have a full year of access to enroll any families they want the following year. So they'll have and families continue access for a year. So that's kind of how we've done it, like providing people a year access beyond the project.
I have a couple of questions. First, you found that coaching was very valuable. Have you considered trying to develop an AI coach?
Yeah, that would be, we have. And we've also considered how to, integrate more AI into this app. Absolutely. I mean, and it's interesting. We actually talked about that in a couple of our focus groups with providers and parents. And there was a mixed reaction to that. Now, of course, that's the way we're moving, right? And some people felt very strongly that would take away from the model not to just be talking to a computer, but other people were like, well, if it's reality based enough, that could be really effective. So, I think it's a really good point, and it may be something that we move toward in the future, obviously with additional funding. That's the issue. All these things require like an additional package of funding.
OSU has a very strong AI package.
Hmm.
You might want to, collaborate with OSU on that.
Yeah, that could be a great collaboration.
Staff, Eugene and Carvel is collaborating on something like that.
Yeah, that would be. Well, I'm glad you said that because actually I don't think that we have those. Well, I don't want to misspeak, but I can't think of anybody at the U of O that's exactly doing that. So it would be great to have that kind of collaboration.
Good. My second question is more controversial, probably.
Okay. Good.
Last night, Dr. Ruha Benjamin from Princeton gave a talk here,
Oh,
a keynote address for Martin Luther King commemoration. And in that talk, he basically severely criticized efforts to try to predict which students are going to have troubles in the future. So this whole thing has become political. Have you seen any political blowback?
from our app.
Just in general.
Yeah. Well, it's interesting. I have kind of a slide on that I didn't put in this talk. I think we've all seen a lot of political blowback on the work that we're doing, right? I mean, someone could frame this work as social emotional intervention, and we've seen a lot of blowback on those interventions in schools. Even the concept of positive parenting could have some pushback against it. So I think that I haven't directly seen that, and we are working with this app in our implementation and app model. Like we have a lot of people in Arizona that are testing it and using it right now, and that's a very different state from Oregon in terms of the people that might encounter it, and we haven't seen any pushback there. But I think you're bringing up a really good point that applies broadly to a lot of the work that we're all doing and just our current state of politics of whether these terms like positive parenting and supporting family relationships are going to become controversial and political. And I think that's possible.
Very from you. Identity population that are just using this app, but I have a question. Is there any difference with parents in terms of the education? Should needs to use this app or just and also another question is about their language who are just immigrants. We can't just use English or Spanish.
Yeah. Yeah, those are good questions. I mean, I'll start with the language one, which is a tough one because we get that one a lot. People are like, oh, can you translate it to Russian? Can you translate it to Vietnamese? And of course, those kind of translations are really, really costly when you're dealing with something that's static like this or like a web-based application. So it's much harder to do. So we don't have it translated to any other language besides Spanish. So parents that enroll would have to speak one of those two languages right now. We do have some colleagues in Sweden that want to create a Swedish version, so that could be fun. Not a big language we're targeting here in Oregon, but anyway, we're always looking for collaborators. So that's how the language thing goes. And see, what was your first question? Sorry, that was on
The education of the parent.
Yeah. Well, that's a good question too. And I can say that we probably haven't been able to totally dig into that as much as we would want to, because in all the samples that I've targeted are pretty much targeting more of an underserved population. So it's hard to do those comparisons. But in general, we find, and this is true for some of the studies that I just showed, that higher risk tends to lead to greater outcomes in the family checkup. That's true of the in-person version, and it seems to be true of the app as well. So parents who have like more need for it and are needing the app more, so they have maybe higher risk at baseline on a variety of indicators like their child's behavior or their own depression, tend to make greater improvements if they engage in the app and use the app. So that's good news, I think, for reaching a wide population. Yeah, no, you keep, don't apologize. You should ask lots of questions.
I was just looking to see if we can download the app. It looks like we cannot. Can
Right.
we do that?
No.
No.
No, you can't. Let me explain that. But essentially, this app is not going to be a straight to consumer product right now. Someday it might be, but that's a really hard space to be able to get parents to do things. And I could talk a lot about this. I mean, there's a lot of parenting apps out there. So it's hard for parents to go on to, like, say, the Apple store and figure out which one is evidence-based, which one. They all say they're evidence-based, by the way. And then you go into them and you're like, well, who made this? So that's a difficult way to reach parents. So what we're doing is kind of going through providers and providing this kind of like we have the family checkup in person as a model that they can use with their population. And then if they sign on to that and they get trained in it, and for the app, we're doing a really brief training, which is just training people on how to onboard people, like 4-hour training and some of the basic theoretical kind of foundations of the family checkup. Then all the population they serve can use the app. So that's kind of how we're dealing with it right now in the marketplace. For now, and I've kind of toyed with this too and had a lot of feedback on it. But yeah, right now it's not straight to consumer.
List, but I was waiting for others in the room.
Yeah.
So could you say a little bit more? You just mentioned the coach training being 4 hours, onboarding. Can you say a little bit more about what goes into that?
Yeah.
Who these coaches still seeing?
Yeah.
What roles are they serving?
Yeah, that's a good question. And I'll kind of talk a little bit about our in-person version too and how we move from that to this model. So the in-person version to train providers in that, really it's pretty time intensive. It's like a 2-day training. It requires, on top of that, a bunch of online training to be able to do all the assessments, understand the scoring, all of that. So what we've tried to do with the digital version is really reduce that so that it's much more manageable and feasible to roll it out in communities. So the digital version involves about a half-day training, and that includes understanding the app, how to enroll people in the app, understanding the content of the app, how to engage with families as a coach and use motivational interviewing techniques, the underlying theory of the family checkup. And so it's a pretty relatively brief training for an evidence-based program. And then as the end of that training, people just, can log in and use it. I didn't show this today, but the back end of the app is like a provider dashboard. And like if you're a provider and you're using this with families, you see a list of all your families. You see all the results of their assessment. You can keep track of how many coaching sessions you've had. You can look at how they scored on all their assessments. And you could be a provider that has like 70 families, and that would all be organized for you on the back end of the app. So we've put quite a bit of time with provider feedback into that piece of it. So that kind of helps manage your caseload, but also helps you deliver it. So there's like a delivery system. We currently have a grant that we're just in the middle of, and we're developing, and we are using AI. We are using AI for this. We're developing an online training that's just basically computer generated, so that there wouldn't be any person that delivers the training to providers, but they just do this course, and the course shows them how to use it, and it's like so it could be like self-serve. And we're just beginning to test that model and see if that works for providers.
So my question is regarding about the trust, that how you develop the trust between the user and the provider, because right now when we are using a word like digitalization of anything, so one question, if I am a parent, so one question will quickly pop up in my mind. So how I will trust this app so my data is secure and confidential.
Yeah.
So that's a hard thing if I'm developing any app and if I wanted to implement it in our community. So how you tackle this thing between a provider and the user?
Yeah, I think that's a really good question. We've kind of wrangled with that too. This is a HIPAA compliant platform, so everything is all the health data is protected, and we tell parents that when they log on, and they see that when they log on, just like you're probably familiar with when you do that at a doctor's office or you fill out anything with data. The data that people give us isn't all that it's not so private that people are concerned about it. Like nowhere on the app do people tell us if they use marijuana, if they use opioids, if they use drugs while they're parenting. None of those questions are on the app. If we're doing a research project and we want to know that, we ask those separately in an interview. But the app itself includes very benign questions like, how often do you praise your child? Do you use incentives? How often do you set rules and consequences? So in some ways that decreases people's anxiety about that as well. But I think you're bringing up a good issue. I mean, we all have to think about that in this digital age of how we protect data and create trust with the people that we're working with.
Yeah. And also, I feel like when we improve the AI models and it get our access to camera and microphones, So that's a biggest
Yeah.
threat to our security and stuff like that.
Yeah. Yeah. That's another good point. Go ahead.
Oh, so I know you said this is positive parenting, but do you also give it for any family caregiver who may not be a direct parent? And
Yeah. Oh, yeah.
and assuming there are two parents in the child's life, do both of them do that, or is it?
They can. That's what's great about an app, right? Anyone can do it. There's 3 providers. Yeah. There can be unlimited access. Everybody can download their own version, do their own version of it, and get all the content. So it can work for a family with multiple providers or just one provider. Yeah, and the provider could be anyone.
So the in-person version of this family checkup, was it ever anything from that child care and child visits?
In pediatric care?
Yeah.
Yeah, there's been a number of projects that attempted to do that with some limited success. I think for the same reasons that we discussed, that it's really hard for providers to do the model in the context of their regular things they need to do. And it's been difficult integrating it into primary care. So there's actually been a couple of different research projects on that. And I would not call them effectiveness trials. I would call them efficacy trials, where hired research staff were providing it in pediatric care. And I think there really hasn't been a successful effectiveness trial with the in-person version on that.
This is kind of
Okay.
I was curious to all of the vignettes used here.
They use some version of the bear family. There's a dad, there's a mom, and sometimes it's the dad and the kids. Sometimes it's a mom. So a male, let's just call it a male figure. Yeah. Sometimes there's a male parenting figure with the children. Sometimes there's a female parenting figure with the children. Some videos have 2 parents with the children. There's 4 children. There's 2 little kids. You saw the little girl, and there's a little boy. And then there's 2 middle school kids, a girl and a boy. And they're all in different videos. And they're never all together in the same video. So it's different versions of of the bear family, essentially.
Have you gotten?
Yeah. It's been pretty much uniformly very positive. It's basically people's favorite part of it are the bear videos. And that's what we get the most feedback on. That's positive, that they like the bear videos. The bear videos are fun. And they're kind of, obviously I only showed one of them. They're kind of funny. So we kind of use like a little humor in there. Like sometimes funny things happen to the bears. And it kind of lightens up the content a little bit. So I think those are probably for parents the most enjoyable part of it. Because you see yourself, just like we all, in the one I showed, we all see ourselves a little bit. And even that one, right? You picture yourself in the kitchen going, are you going to come for lunch or whatever? We all make those kinds of parenting errors, if you want to call it that. So they're meant to be like that, really approachable, where most people can see themselves in it. And then they can see a different way of doing it and think, oh, that might work with my kid. And it is more effective, right? Or a partner. Yeah. Or anyone living in a home, a dog. Yeah. Yeah. And asking them nicely. Yes. And using praise, right?
And that goes along with and does your team develop all the
Yeah, we wrote them all.
is as you're outstanding and creative?
Yeah, well, I don't think I'm that creative. I do have a great group that I work with over a long period of time now. A lot of intervention specialists that have worked with our team for 10 years, and a lot of people with a lot of family experience, early childhood experience. We do have the book, Everyday Parenting Curriculum. The first version of it came out in like 2012. And then our updated new version came out this summer, last year, 2024. And a lot of the content of the app, as well as the content of our in-person version, is drawn from that book. And so we did a major upgrade to the book last year, and that's the new version, 2024. And it includes a lot more content on the things parents are dealing with today, like social media, cell phone usage, bullying at school, some of the themes that we see are more and more common in parents today than they were 10 years ago when we wrote the first version. So much of the content comes from that. Yeah. Yeah.
You're on first. Anyone else? So just in going back to some of the conversation that's come up around even, as you said, the definition of positive parenting.
Yeah.
And in our work around the state with mostly in-person parenting education programs and classes, as well as online, but online with live interaction, we found that just the tremendous need for, even when we're looking at positive parenting as defined by our research and evidence behind it, the importance of really having that embedded in cultural contexts for families. So with our work with OPEX, many of the hubs are now trained in many different curricula, so they have a wide menu to offer holistically, culturally, thinking about representation of who's delivering the programs, reflecting those cultures. And we mentioned the app, the adaptation, like I select families, not just linguistically, but culturally.
Yes.
You think about that universal spread of the app, or if we do more families, more communities,
Right.
more folks, you have, all of this comes with the grants and funding.
Yeah.
You see that adaptation culturally, holistically coming with multiple different versions of the app.
It could be.
Is with coaching support to help families really identify and see themselves within an app, even if it looks different from their family.
Yeah. Yeah. I mean, I think that would be ideal. That's been for me one of the hardest things about developing an app and this kind of digital product is because once you develop it, it becomes pretty static, right? And then the money that you need to even do, I've been surprised by this, but I mean, I shouldn't be. Every little change, it's like, oh, that's $20,000. Like, what? We're just changing a few words. I mean, like every little thing you do to it, once you develop it, it's really expensive. And so that, I mean, obviously what you said is absolutely true. We need grants that we, like this one for my colleague Jen Doty, that's really focused on its population, that'll really allow us to do those adaptations. But I absolutely see other forms of adaptation. I mean, some of the other kind of grants we have in the hopper around adaptations, on a path to being funded, we hope, we'll see, is one that's focusing on children with autism. That would create a module for that. And that would be with my colleague, Laura Lee McIntyre at the University of Oregon, who's our dean of the College of Ed right now. And that's her area of work. So I'm excited about that if we get that funded. And then my colleague at University of Wisconsin, Andy Garbitz, just got a grant funded this year focused on creating a module around threat assessments for like middle school and high school students. That'll right now, when threat assessments occur in schools, there's hardly any family component. And that's been a real need for schools to understand and be able to engage families around that. And obviously, we're talking about pretty high-risk kids. And so he's wanting to develop a module that just focuses on kids who have threat assessment need and has some more of the high-risk behaviors that parents might experience with that kind of assessment and how to manage them. So we're just starting that. So those are some of kind of the adaptations that we have that we're thinking of adding. So that would be the best thing, is to be able to develop different modules people could pick and choose from and add for their population. So I hope we're going there.
I mean, I'm an online question.
Oh.
Yes. Yeah, me too. Okay. So maybe I just this, but is the app easily searchable for issues parents may use? So one good mind tips, lynch breaks. We've been doing good luck. I think we said it's probably not. But
Yeah, you can't get it as a consumer.
yeah.
Yeah. You'd have to be connected to a provider that's offering it right now.
So in terms of that question, though, the way that I heard it was thinking about, can parents go back and look for specific topics within the app if they're in it already?
Yeah.
Is the app just one directional if you're moving through, or is it something you can go back and use?
Yeah, exactly. I'm glad you said it that way because I kind of heard two things there too. So yes, once you go through the app, you can go back. You could go backward anytime. And in fact, you go straight up to the top of it to your dashboard and it'll take you back to all the modules. So if you're a parent and you went through and you're like, I really like that bear video and that content, I want to go through that again, you can easily go through it again at any time. And when you finish the whole app, you can go back through the whole thing again or just different parts of it in any order once you're done with it. So yeah.
So we just want to honor that it is 2:00. Folks have Thank you for being here for this hour. Dr. Stormshak has also graciously agreed to stay for another hour for informal Q&A or questions or conversation if you'd like to stay and continue the conversation. But before we close, shall we thank Dr. Stormshak again?